The choice of whether or not to get off metformin, a frequently prescribed medication for controlling type 2 diabetes, is a weighty decision influenced by a multitude of factors, side effects, alternative medical advice, or alterations in treatment direction. All contribute to the complexity of this choice. Our focus in this video is the intricate adjustments your body undergoes post-metformin cessation. Our mission is to provide you with holistic, compassionate support throughout this pivotal transition. One of the most immediate and worrisome consequences when diabetics stop taking metformin is a possible surge in blood sugar levels. Metformin enhances your body's responsiveness to insulin and curbs your liver's release of glucose into the bloodstream. Without metformin, your body might not utilize insulin as efficiently, potentially prompting your liver to ramp up glucose production, thereby elevating blood sugar levels. This shift poses a significant challenge as it heightens the probability of long-term diabetes-related complications, like nerve damage and cardiovascular issues. Vigilantly tracking your blood sugar levels becomes paramount during your transition off of metformin, necessitating frequent monitoring and seeking guidance from your healthcare providers. While there are legitimate homeopathic methods for getting off metformin, you must collaborate closely with your dietary expert to devise a strategy. Your dietary expert will outline a plan to uphold optimal glucose control through dietary adjustments, physical activity, or alternative medications and natural products that will mitigate the associated risks effectively. For those of us with diabetes, discontinuing metformin may also result in fluctuations in weight. Metformin's impact extends beyond blood sugar regulation to influencing appetite, often resulting in weight loss or stabilization. When first getting free from metformin, a surge in appetite may become apparent, potentially paving the way for weight gain. This development can be particularly disheartening for those grappling with weight management challenges. However, it's imperative to grasp that these shifts aren't indicative of failure, but rather signify the body's natural adjustment to a fresh metabolic equilibrium. Mitigating weight gain entails a multifaceted approach, encompassing a balanced diet replete with essential nutrients and adhering to a consistent exercise routine. A good homeopathic supplement can easily help you overcome this devastating side effect or withdrawal symptom. Another side effect of stopping metformin usage can trigger the reappearance of symptoms associated with elevated blood sugar levels, including frequent urination, intensified thirst, and heightened hunger. Metformin plays a pivotal role in managing such symptoms by enhancing insulin sensitivity and regulating glucose production in the liver. In its absence, your body may encounter challenges in maintaining blood glucose stability, paving the way for the resurgence of these discomforting and disruptive manifestations. Vigilantly monitoring your blood sugar levels upon discontinuation is imperative, as early recognition of these indicators can stave off more severe complications. Frequently communicating any changes in your blood sugar readings to your healthcare professional is essential when exploring alternative treatments. Discontinuing metformin can also escalate the risk of long-term diabetes complications. Complications to look out for include cardiovascular disease, nerve deterioration, kidney dysfunction, and retinal damage. Metformin assumes a pivotal role in orchestrating blood glucose regulation, and without its stabilizing influence, blood sugar can spiral exponentially upwards. Persistent elevated blood glucose levels pose a grave threat, sometimes culminating in the gradual erosion of blood vessels and nerves, thereby setting the stage for the onset of these formidable complications. Hence, it is imperative for those trying to get off metformin to embark on a quest for alternative avenues to effectively manage their blood sugar. Finding a quality natural healing program along with physical exercise is of paramount importance. Understanding the increased risks and addressing them promptly with the effective help of a dietitian trained in holistic healing can help maintain quality of life and reduce the likelihood of severe diabetes-related complications. Another of the possible side effects of metformin withdrawal is a change in the blood lipid levels. Some diabetics have reported seeing a rapid change in blood lipid levels after quitting metformin usage. As such, there is a profound risk of negative impact on cardiovascular health. One of the functions of metformin is that it works as a catalyst in enhancing cholesterol and triglyceride profiles, by again curbing the liver's glucose production, thereby indirectly mitigating fat synthesis within the liver. However, without metformin, this salutary effect dissipates, potentially ushering in a surge in LDL cholesterol and triglycerides, accompanied by a dip in HDL cholesterol levels. This flux poses a tangible risk of setting the stage for the development of heart disease. Hence, it behooves patients to adopt a proactive stance in monitoring and managing these prospective fluctuations. This entails proactively getting lipid profile assessments regularly and engaging in candid dialogues with healthcare providers regarding dietary modifications and potential medication or natural supplements as substitutes. Embracing a lifestyle anchored in heart-healthy practices, including regular physical activity and a well-rounded diet, is of paramount importance in preserving optimal lipid levels and fostering holistic well-being. Metformin has gained infamous notoriety for its array of gastrointestinal side effects, including nausea, diarrhea, and abdominal discomfort. When you stop taking metformin, your gastrointestinal system takes a journey of adaptation to the absence of this medication. These adjustments may culminate in a stabilization of digestive processes, potentially alleviating gastrointestinal distress, a welcome respite for many patients. It's like your digestive system breathes a great sigh of relief. However, for a few individuals, this transitional phase may catalyze the onset of novel digestive issues or the resurgence of symptoms previously managed by metformin. As with all the other withdrawal symptoms, having a relationship with a holistic nutritional professional who can help you tweak your dietary habits and integrate probiotics or digestive aids will give you the support you need to successfully navigate this transition and maintain optimal digestive health. As we turn to another effect of getting off metformin, we are looking at a symptom that can have a tremendously positive effect on your long-term well-being. The prolonged usage of metformin is intrinsically linked with a decline in your body's ability to absorb vitamin B12, potentially culminating in a deficiency over time. This phenomenon is due to metformin's interference with the calcium-dependent digestive functions pivotal for your intestines to absorb vitamin B12. Diabetics who discontinue metformin will experience a conceivable favorable outcome in the normalization of vitamin B12 absorption, a gradual remedy for the deficiency. However, in instances where the deficiency has already taken deep root, merely halting metformin intake may not suffice to rectify the situation. Consequently, individuals subjected to long-term metformin therapy ought to undergo periodic testing of their vitamin B12 levels and, if necessary, take quality natural supplements to augment and stabilize B12 levels. Attention to and addressing this critical concern cannot be overstated, given vitamin B12's vital role in facilitating nerve function and the synthesis of red blood cells. Metformin serves not only as a cornerstone of blood sugar and diabetes management, but is also used by the medical community to address conditions such as polycystic ovary syndrome, PCOS. PCOS is characterized by both insulin resistance and hormonal imbalance. By elevating insulin sensitivity, metformin helps to reduce insulin levels in the blood, thereby normalize hormonal levels, notably curbing testosterone levels in women with PCOS. However, when women stop taking metformin, a potential reversal in these hormonal effects may be experienced. This many times may result in the return of symptoms like irregular menstrual cycles, excessive hair growth, or acne. For individuals navigating these tumultuous changes, alternative holistic therapy and healthy lifestyle intervention will go a long way to help maintain proper hormonal balance. Having a clear understanding of these potential side effects and collaboration with your dietitian can prepare and empower you to make the right decisions that will mitigate these negative effects. Discontinuing metformin can lead to significant changes in the body, including increased blood sugar levels, weight fluctuations, and altered lipid profiles. It's important to be aware of these potential effects. Monitor health closely and consider lifestyle adjustments to manage and mitigate the impacts effectively after discontinuation. And if you are interested in learning how I got free from my diabetic medication, follow the link in the description where I tell you all about it. Thank you for watching. Goodbye for now.